We begin this morning with correspondent Erin Moriarty, who's looking at why so many Americans seeking health coverage find themselves in a state of denial.
It was heartbreaking and it was awful.
Tracy Hurley says watching her husband battle cancer in late 2021 was harrowing.
I lived in fear every day.
A battle made worse, she says, because so many of the skirmishes were with their insurance company.
No family should have to go through having to fight to get treatment as recommended by their physician covered while fighting for their lives.
Is that what Dan was doing?
Yes.
Millions of Americans say they are struggling to get medical care, either unable to pay sky-high deductibles or, like Dan Hurley, denied coverage for tests and treatment by health insurance companies.
If we as two physicians had to struggle the amount that we had to struggle to get care approved, what about people who do not have medical knowledge? What's happening to them every day?
Not only are both the Hurleys doctors, Dan, an ear, nose, and throat surgeon, was also skilled in cutting through insurance red tape for his patients.
And yet we still ran into issues a lot.
Dan was an avid hiker until a nagging backache turned out to be cancer.
Diagnosis was chondrosarcoma, which is a ultra-rare bone tumor.
To try to save his life, the tumor, along with Dan's hip, had to be removed. Insurance only covered a portion of the costs.
Many of his treatments were denied. We had PET scans, we had CT scans denied, we had chemotherapy, we had radiation, we had certain medications that required prior authorization and were denied.
On what basis?
Not medically indicated.
Health insurance companies know that 5% of their members account for 50% of all the cost. So I have this huge financial incentive to make their lives as difficult as possible.
Ron Halrigan, now a consultant, spent 2 decades working for health insurance companies and says the business model is unlike other industries.
The more your customers use your product, the less money you make. Your incentive is to keep them from using your product.
How often do insurance companies refuse to cover the cost of medical treatments? Well, it's hard to tell. Health insurance companies are only required to report denial data for plans purchased through healthcare.gov. A CBS News analysis of about 1.3 billion federal health insurance claims across 3 years shows that in 2024, insurers denied 19% of in-network claims. But for the biggest insurer, United Healthcare, that was a steep drop from the preceding 2 years, when it denied as many as 1/3 of its federal claims. While it did not provide data to support it, United Healthcare says that across all its plans, their initial denial rate is 10%. They also point out that when employers are self-insured, the plans they choose for their employees dictate coverage decisions.
The insurance companies have honestly made it more difficult to be healthy in the United States. This is a surgery center really built for patients affected by breast cancer.
Dr. Elizabeth Potter is a surgeon who sees as many as 60 patients with breast cancer each week at her Red Bud Surgery Center in Austin, Texas. She says insurance denials actually add to costs.
I have 2 employees who spend almost all day navigating insurance. It seems that everywhere we turn, there's an issue, whether it's an insurance company saying, we won't cover your surgery at that surgery center, or we won't pay for that medication. We want you to be on a different medication.
All right, here we go. All right, let's do this.
Case in point, on an early morning this past fall, Jeannie Lee, a 40-year-old mother with breast cancer, was being prepped for a procedure that could have been done 2 weeks earlier during her double mastectomy. But both her and her husband's insurance companies refused to cover the cost.
Today I'm having a lymphovenous bypass.
Lee is at high risk for developing a condition known as lymphedema.
I mean, it becomes very difficult to just use your arm. It can be painful, it's swollen, it's also deforming.
I'm 40 years old, I have 3 young kids. It's very necessary to do this procedure.
Once Lee was able to obtain financial assistance through a new nonprofit set up by Dr. Potter, she was back in surgery.
This patient is having an extra surgery, a separate general anesthetic, because her insurance company wouldn't cover the surgery. We could have done this very easily at the same time.
When she isn't in surgery, Dr. Potter is often on the phone,
Probably insurance.
defending her treatment decisions to insurance company medical directors who she says often know little about her area of medicine.
Sometimes I get, an ophthalmologist,
An eye doctor.
an eye doctor. It was just completely absurd.
You won't give me your name or number, and neither will the doctor from Texas. Okay.
Dr. Potter sometimes posts her side of those conversations online.
Okay, so we're speaking about lymphedema of the arm. So this is not an area that you're familiar with, correct?
Insurance just keeps getting worse.
But a video she posted in early January 2025, she says, ended up putting her entire medical practice at risk.
I got a phone call.
While she was in the operating room, Dr. Potter says she got a call from United Healthcare.
It's never happened before. I didn't know what was going on, but they said it was urgent and I needed to call. And so I did.
That urgent call, she says, was to question why her patient needed an overnight stay in the hospital.
I am operating. I'm doing the right thing for the patient. I'm going to keep her overnight. I walked out of the hospital and I just filmed myself in my unfiltered, moment.
It's out of control. Insurance is out of control.
Shortly after she posted that video, she got a letter from the insurance company threatening to sue her for defamation.
I'm taking great care of patients. They're just trying to scare me into being quiet.
Scared?
I was scared.
United Healthcare has not taken Dr. Potter to court. They declined an on-camera interview, but a company spokesperson says the call was due to an erroneous order, and a doctor would never be asked to leave surgery for a call about an insurance matter.
All of us are vulnerable to being denied. Not all of us can weather the storm as easily when it comes to appealing and overcoming these barriers.
Miranda Yaver, an assistant professor at the University of Pittsburgh, says insurance companies know that only a small percentage of people will actually appeal claim denials. She calls it rationing by inconvenience.
A lot of people don't know that they even can appeal.
So you're saying that it's not really the denial that ends up keeping people from getting care, it's that the people give up?
Fewer than 1% of those claim denials result in appeal, even though people are winning roughly half the time.
Clearly, it does pay to appeal, but some patients like Dr. Dan Hurley, fighting an aggressive cancer, run out of time. Much of his last months were spent, says his wife, on the phone with insurance company personnel.
He would go line by line with them and they'd say, okay, yeah, we need to get a supervisor involved. We'll call you back. And then they don't.
Dan's goal, she says, was to see insurance companies held to a standard similar to doctors, making them liable for malpractice when they deny life-saving care.
The act of signing that denial is practicing medicine. The same way if a patient came to me and I made a decision about treatment and that decision went sideways, I'm liable. That's how it works.
Dan Hurley died on August 3rd, 2023. 1 week later, his wife got a letter from the insurance company asking her to pay for a round of chemotherapy that had been pre-authorized but was suddenly retroactively denied.
What kind of money are we talking about?
$80,000. It was such a gut punch to get it that day. This is unbelievable, right? Almost laughable.
Dan Hurley's battle has become his widow's.
There's part of me that says, oh, he would be so proud of me. But there's also part of me that he'd be like, come on, chop, chop, you got this. Let's go. Pick it up. Don't be sad. You know, keep going. Because that's what he was like.